Every practice manager knows the feeling. You submit a high-value Medicare claim, expecting a routine payout, but instead it hits a wall, all because of a single missing number, 11 digits to be exact. That number is the Medicare Beneficiary Identifier, or MBI. When it is wrong, outdated, or left off the claim completely, the system instantly kicks back a CO31 denial reason code. This initiates a manual chase loop, forcing staff to navigate multiple portals and call unreachable patients. While the denial happens in milliseconds, resolution takes days. A single MBI error can freeze a claim and tie up staff for a full week. What should be a basic administrative step becomes a total revenue bottleneck, stalling the cash flow your practice relies on to operate. This isn't just isolated data entry errors. MBI failures are spiking because of massive data breaches at Medicare contractors that force CMS to act. As this chart illustrates, the scale of the disruption is enormous. In April 2026, CMS reissued 1.3 million new MBI numbers all at once. For medical practices, this means your entire Medicare patient census may have outdated identifiers. If you bill using the old data, the claim will be rejected immediately. In this environment, relying on historical patient records is a direct financial liability. Most practices try to solve this surge in errors by using more manual labor, but the math behind that decision is brutal. Look at the cost difference per transaction. A manual eligibility check costs roughly $6.78 and takes up to 17 minutes of staff time. An electronic check costs just 34 cents. Then there is the human cost. Front office support staff have a 40% annual turnover rate. You are constantly spending time and money to train new people on a process that is already inefficient. When you factor in base wages, training, and a 38% benefits load, a single in-house verification specialist costs your practice between $55,000 and $84,000 every year. This creates a double drain on your margins. You lose revenue to denied claims, and you pay a premium for the staff assigned to chase them. This work is also more complex than it looks. Accessing the CMS HETS system requires precise query formatting. A single transposed digit returns a not found result and triggers a denial. Staff must also navigate a fragmented landscape of separate portals for Medicare Advantage plans and complex coordination rules for patients who are dual eligible for Medicare and Medicaid. This isn't generic data entry. It is a technical operation that requires specialized knowledge, the kind of institutional expertise that walks out the door every time an employee quits. To break this cycle, high-performing practices are moving verification out of the front office and handing it to a dedicated AAPC-certified team. The integration is designed to be frictionless. These specialists work directly inside your existing EMR, whether it's Epic, Athena, or eClinicalWorks, so there is no new software to learn or platform to migrate. They implement an overnight workflow, running batch eligibility queries against your full schedule 24 to 48 hours before the patients ever arrive. This process uses AI to flag exceptions instantly. While clean data moves through automatically, any missing or reissued MBIs are routed to a human specialist for immediate resolution before the patient checks in. Because every AI-driven result is verified by a certified specialist, the system maintains an error rate below 1%. The financial difference is clear. A dedicated Staffingly specialist costs $399 per week. Compared to the $77,000 average annual cost of an in-house employee, this represents an overhead reduction of up to 70%. That flat rate covers SOC 2 security compliance, ongoing training, and staff turnover management, normally hidden burdens on your practice. You gain higher technical accuracy while simultaneously reclaiming tens of thousands of dollars in operating margin. Implementing this doesn't require a long transition. Most practices are fully operational within 5 to 10 days. Start a 14-day risk-free pilot on a single location or specialty with month-to-month flexibility and no long-term contract required. MBI verification should no longer be a manual chore. It's time to install a secure, expert-driven firewall to protect your practice's revenue.